Hi, in today's video, I'm going to be talking about why taking anti-inflammatory medications should be avoided after a gastric bypass surgery. See, what is important to understand is that anti-inflammatory medications are irritant to the inner lining of the stomach. I've got a model of the stomach over here that I'll use to explain what happens when you have actually had a gastric bypass surgery and what will be the impact of taking anti-inflammatory medications such as ibuprofen or even Motrin or Advil. These are the medications that have got a specific compound in it, which is ibuprofen, which actually impacts the protective lining of the stomach. Now, what happens is that in a gastric bypass surgery, this is just a model of the stomach, and you can see that we make a pouch of stomach and we attach a segment of the small bowel to it. So just ignore that bit, but this is really the effective stomach which is remaining when an individual has had the gastric bypass. Now, when you take a anti-inflammatory medication, it starts to create irritation to the inner lining of the stomach, and that inner lining leads to more production of acid, and the ulcer that is generally formed is on the small bowel side because that acid goes onto the small bowel and creates that damage, creates that ulcer. That ulcer can then lead to bleeding, and that leads to iron deficiency anemia. So what we often say is at least for 6 months after you've had your gastric bypass, you should avoid taking an anti-inflammatory medication. If you do have to take the anti-inflammatory medications for whatever reason, then please make sure that you have discussed that with your medical practitioner, your GP or your surgeon, and please always take it with a proton pump inhibitor such as Nexium or Losec, I should say, because it allows the protection, the acid that is produced, it is reduced, so the damage that is caused to the small bowel, which is attached to that part of the stomach, is reduced. And with the patients who have had the gastric sleeve surgery, it is also important to understand that in sleeve surgery, you have got this portion of the stomach that has been removed. The damaging effects are not as much. However, it's always a good idea to take Nexium or Somac or any other acid suppressing medications when you are also taking the anti-inflammatories. I hope you found this video useful. If you did, please do subscribe to my channel and stay connected for further videos. Thank you.